Hi, I'm Dr. Ed Heidelberger, Vice President of Medical Affairs here at the Bertrand Chaffee Hospital, bringing you another coronavirus update. Since our last update, things in this area have gotten a little bit worse. In fact, we have seen the highest number of cases in all of New York here in Western New York. This is not a record we're proud of. Nevertheless, if you look at the positive percentage rates in the different counties around here over the last 24 hours, it's pretty concerning. Cattaraugus County was 18.6%, Erie County was in the 10% range, and Wyoming County was down around 9%. Because of these high rates of coronavirus, we're seeing the impact on our local hospitals. The hospital waiting rooms and the emergency departments have gone up significantly, and hospitals are full at capacity. In some of the hospitals, they've actually stopped doing ambulatory inpatient care now because of this, and they had to cancel surgeries because of the number of patients in the hospital. This is all a serious concern. And not only that, we've seen the introduction of Omicron variant now coming in from, well, you all heard about it 2 weeks ago from South Africa. Well, it's already here in Western New York, as well as in the entire New York State. There's been 8 cases now and more coming. So we've seen the spread of the variants, we've seen the increase of cases, and we ask why. Well, first of all, we need to be vaccinated. Vaccines have been shown to be safe and effective, and yet there's a significant portion of our population here in Western New York that has not been vaccinated. As physicians, we find this hard to believe because we know that that is one way to protect people from the coronavirus. It's not 100%, and there have been breakthrough cases, and we may need to be revaccinated periodically, as is happening now. So, with that, I would like to thank everybody who participated in the recent hospital Erie County Department of Health coronavirus vaccine initiative that happened last week. Over 190 people took advantage of that and got their vaccines. There'll be more of these occurrences in the future and around our area, so stay tuned to the local news to see when these vaccine clinics are being held. In addition, the pharmacies around our area also offer the coronavirus vaccine. Please take advantage of that. This is one of our tools in our armamentarium to get rid of this coronavirus and keep ourselves safe and happy this holiday season. Number 2, and most important, is why we're coming to you today with these masks. Masks prevent the spread of disease. And let me give you a good example. If you take a candle and you light the candle and try to blow it out with a mask, watch what happens. I can blow as hard as I want, and the candle does not go out. Now, without the mask, of course, it goes right out. It's not a trick candle. That is the same thing what happens when we cough or sneeze and our air gets expelled from our mouths. It goes through the room, around the room, and to anybody else in the environment. With the mask on, it does not do that. We limit the spread of the virus from the carriers. Now, we don't know who are carriers, and you've also heard that there are a lot of people who may be asymptomatic carriers. And even some people who have had the vaccine may be carriers. That is why everyone should be wearing a mask. Now, I know there's a lot of political things about your rights and others' rights and things like that, but common sense must prevail here. Get vaccinated, wear a mask, and, hard as it might seem, social distancing. When you're with groups of people, make sure people are wearing their masks and are vaccinated for protection and preventing of the spread. So those 3 things have helped keep us safe in the past and will continue to help us stay safe for the future. Now, I'm going to turn the camera over to my colleague, Dr. Darryl Wenner, in the emergency department for an update there.
Hi, I'm Dr. Darryl Wenner. I'm the Director of Emergency Medicine and Hospitalist Medicine here at Bertrand Chaffee Hospital. We just want to give a little update on what the challenges are that we're facing currently with this current healthcare pandemic. Unfortunately, we'd like to apologize ahead of time. We are having record-long waits. I know that you're used to being able to come in and get in and out of Chaffee in a hurry. But unfortunately, we can expect extremely prolonged wait periods, so please take that into account when you're coming to the emergency department for your critical medical needs. Any of your more routine needs or your more minor complaints, we absolutely encourage you to call your primary care physician so they can give you further guidance on whether or not you need to come to the emergency department. We encourage everybody to get their vaccination and keep doing the best they can to help stop the spread of this pandemic, unfortunately.
Thank you, Dr. Wenner. And now I wish all of you a healthy and happy holiday season from all of us here at Bertrand Chaffee Hospital. And most importantly, be safe, get your vaccine, wear your masks, wash your hands, and social distance. Thank you.